The question on everyone's mind, is it really possible to enlarge a penis? This topic has piqued the curiosity of many, leading to a whirlwind of myths and misconceptions. But it's high time we sift the fact from fiction, cut through the noise, and get to the heart of the matter. Using a blend of science and medical insights, we will attempt to settle this burning question once and for all. So, without further ado, stay tuned as we dive into the world of science and medical advice to find the answer. Before we delve into the topic, it's essential to understand the anatomy of the penis. So, let's get started. The penis is more than what meets the eye. It's made up of several parts, many of which are internal. The visible part is known as the shaft, and at the end of the shaft, you'll find the glans, which is often referred to as the head of the penis. Inside the shaft, there are 3 tubes of erectile tissue. 2 larger ones on top are the corpora cavernosa, and a smaller one on the bottom is the corpus spongiosum. The urethra, which carries urine and semen, runs through the center of the corpus spongiosum. Now let's talk about the corpora cavernosa because they play a key role in erections. These are sponge-like tubes that fill with blood and harden during arousal. They're like balloons that inflate when you're turned on. The corpus spongiosum also fills with blood, but it doesn't harden like the corpora cavernosa. This ensures that the urethra remains open for ejaculation. So, how exactly does an erection occur? Well, it's a fascinating process, really. When you're sexually aroused, signals from your brain and nerves cause the muscles in the corpora cavernosa to relax. This allows blood to flow in and fill the open spaces. As the pressure builds, the penis expands and hardens, leading to an erection. However, the corpora cavernosa can only fill with so much blood, and their size limits the length and girth of the erection. This is why the size of the penis when erect can vary from person to person. Understanding the anatomy of the penis and how erections occur is crucial when considering enlargement options. It helps us grasp the biological limitations and the potential risks involved. Now that we understand the basics, let's explore the possibilities of enlargement. Experts and doctors have weighed in on this topic, and here's what they have to say. From the medical perspective, the question of penis enlargement is not as straightforward as it may seem. There are a myriad of views and opinions, each backed by its own set of studies and professional experiences. Dr. John P. Mulhall, a renowned urologist at Memorial Sloan Kettering Cancer Center, points out that most men who think they have a small penis actually fall within the normal range. The average erect penis size is 5 to 6 inches, and the vast majority of men fit into this bracket. However, for those who are still concerned, there are medical interventions such as surgery. Penis enlargement surgery, also known as phalloplasty, involves cutting the ligament that attaches the penis to the pubic bone, allowing it to hang a bit more. However, it's important to note that this doesn't actually increase the size, but rather the perceived length. While this might sound like a promising solution, it's not without its risks. Complications can include infection, nerve damage, reduced sensitivity, and difficulty getting an erection. Furthermore, the American Urological Association does not endorse penis enlargement surgery for cosmetic reasons due to these risks. Dr. Tobias Kohler, a urologist at Mayo Clinic, explains that there's a disconnect between what men want and what's medically possible. He states, the majority of men who come in seeking penile enlargement are average. They're not really anatomically small, but they're unhappy with their size. In addition, it's important to note that most of the studies conducted on penis enlargement surgeries have reported patient dissatisfaction. The dissatisfaction stems from unrealistic expectations, complications, and the high cost of these procedures. So, to sum it up, while surgery might seem like a viable option for some, it's not without its drawbacks and risks. It's crucial for individuals to thoroughly research and consult with medical professionals before making such a significant decision. While surgery might seem like a viable option, it isn't the only one. From pills to pumps, there are several alternatives marketed for penis enlargement. But do they really work? Let's dive in and explore these options, starting with the most common one, pills. Various companies manufacture and market pills claiming to enlarge the penis. However, the effectiveness of these pills is largely unproven. Most of these pills contain herbs, vitamins, and hormones. But there's no scientific evidence to support the effectiveness of these ingredients in increasing penis size. Also, these pills can have potential side effects such as heart palpitations, headaches, and allergic reactions. Next up, penis pumps. These devices create a vacuum around the penis, drawing blood into it and causing it to swell. Pumps can make the penis look larger temporarily, but they don't result in permanent enlargement. Regular use of these pumps can lead to weak erections, and overuse can cause damage to the elastic tissue of the penis, leading to less firm erections. Now let's talk about exercises. Jelqing is a technique that involves repeatedly pulling or milking the penis to increase its size. Although some men claim to have seen gains, there is no scientific evidence to back these claims. Moreover, jelqing can lead to serious damage to the penis, including scar formation, pain, and erectile dysfunction. Then there are extenders and weights. These devices stretch the penis over time, but they come with significant risks. Overuse can lead to nerve damage, reduced sensitivity, and even impotence. And let's not forget about the discomfort and inconvenience of wearing these devices for several hours each day. Finally, we have patches and creams. These products claim to increase penis size through transdermal delivery of ingredients. However, like pills, there's no scientific proof that these products work, and they can cause skin irritation and allergic reactions. So it seems like there's no magic pill for penis enlargement. As we've seen, many of these methods carry significant risks and side effects, and their effectiveness is largely unproven. It's always best to consult with a healthcare professional before attempting any penis enlargement method. But is penis size all that matters? Let's look at the psychological aspect. Many men, perhaps even the majority, have at some point questioned whether their penis size is normal. This anxiety is often fueled by societal pressures and unrealistic representations in media. But what does science say about it? Several studies have shown that men tend to overestimate what's considered normal when it comes to penis size. In one study, researchers asked men to estimate the average penis size. Most men overestimated, assuming the average to be significantly larger than it actually is. This misperception can lead to unnecessary stress and low self-esteem. But here's the thing, sexual satisfaction is not solely dependent on size. It's a complex interplay of emotional connection, physical attraction, and effective communication. Many studies have found that most women don't consider penis size to be a primary factor in their sexual satisfaction. Instead, they value things like emotional intimacy and the ability of their partner to satisfy them in other ways. It's also worth noting that obsessing over penis size can actually lead to a condition known as penile dysmorphic disorder, where a man perceives his penis to be smaller than it actually is, even if it falls within the normal range. This condition can lead to severe anxiety and depression, and often requires psychological intervention. So if you find yourself worrying about your size, remember that it's likely you're perfectly normal. And even if you're not, remember that size isn't everything. There's so much more to sexual satisfaction and self-confidence than a number on a ruler. Of course, if you're experiencing severe anxiety about your size, it's always a good idea to seek help. A mental health professional can provide you with strategies to manage your anxiety and help you develop a healthier body image. Perhaps it's more about confidence and less about size. After all, confidence is something that can definitely be worked on and improved, and it can make a world of difference in your sexual and overall well-being. So, is penis enlargement really possible? This question has been our guide throughout this exploration. We've dissected the anatomy of the penis, delved into the medical perspective, and considered the alternatives to surgery. We learned that surgical options do exist, but they come with their own set of risks, and the results can vary widely. It's a serious decision that should be made with a healthcare professional, taking into consideration not only the potential benefits, but also the potential complications. As for non-surgical methods, we found that many lack solid scientific backing. From pills and potions to devices and exercises, many of these methods are based more on marketing promises than on proven effectiveness. They can even pose risks to your health and well-being. We also touched on the psychological aspect of penis size. Feeling comfortable in your own skin and having confidence in your abilities can have a much more profound impact on your sexual satisfaction than physical size alone. Remember, it's not just about the physical, but also about the emotional and psychological aspects. A healthy body image and self-confidence can enhance your sexual experiences far more than any supposed quick fixes. So, to answer our original question, yes, penis enlargement is technically possible, but it's not necessarily the best or only solution. In the end, it's not about size, but about how you use it and how confident you feel.